Good evening. I am Tony Dottino doing my Live with Tony on Wednesday in the 7 o'clock hour. And tonight's broadcast is interesting, or tonight's Live with Tony is going to pick up from the September issue of the Tufts Nutrition Letters. Very, very interesting. It's the September issue of Tufts, and they have a special report. So it's got a special report in here. And then they include a supplement. And what they're really talking about in both of the sections here are the impact of preserving brain health as well as your heart and the connections of them. But what I wanted to start with is they talk about over here is the use of alcohol. And is alcohol really a benefit to us or not? And what's important to me about the alcohol is we've just finished, or I just finished, doing a series on sleep. And here we come with alcohol and sleep. And I cannot tell you how many people have asked me through the years, is it true that alcohol really helps your memory and helps build a better brain? And I've always found that to be very ambiguous from the science world. And here we are, September of 2020, and we're still finding a level of ambiguity within it. But let me start by tying in my sleep lessons, which I just finished doing, and talking about from the American Sleep Foundation, 20% of Americans use alcohol to help them fall asleep. Maybe I'm naive, I just think 20%. How does that feel to you? Does 20% of people, that's 1 out of 5 people, and I'll assume they're adults, 1 out of 5 adults use alcohol to help them go to sleep. And I just finished doing a series of exercises on sleep. And so here we go, 20%, and they use it before bedtime so they can go to sleep quickly. But here's what the problem is. It impacts the deep level of sleep, REM, which impacts our encoding on memories. It impacts our ability to get the right toxins getting cleaned and purified out of our brain. It doesn't give us the restful sleep that we're craving by getting to sleep. So here we know we've got to get to sleep, and people put so much effort into it. And here we're coming along and we're having alcohol drink and go to sleep. But it's not the best restorative sleeping that we need to regenerate our brain and our coding of memories and things. So we wake up in the middle of the night, and it's so bad. You wake up in the middle of the night, now you say what? Because your circadian rhythms, right, or your sleep cycles that you want to keep in a beat are bad. And then it's diuretic, and so you got to get up and you go to the bathroom. So now you've had your alcohol, so now you've messed your sleep, then you've got to go to the bathroom after it. And alcohol is a muscle relaxant, and it makes you more prone to sleeping and snoring and apnea because it relaxes the muscles in your throat. So inadequate sleep, then we know your weight gain, your anxiety, your blood pressure, your heartbeat, diabetes, and heart disease. And so now we are using alcohol to get to sleep and look at all of the detriments. And I wonder if people put those on a scale, if they would be still looking to have alcohol as a way to get to sleep. Now, last week I covered the things that you can do, so I would just encourage all of you to go back and look at some of my Live with Tony videos over the past 5 days, and I give you suggestions on how you might get back to sleep, possibly with trying 1 or 2 days a week without alcohol. But now it comes back and it says, okay, there is no proof that moderate alcohol consumption offers any protective effects on your brain or on your heart or in your whole body system. So it talks about in this research here that there's no benefit to it. People who report moderate alcohol often, so here's the challenge, right? So the benefits of alcohol, and they've done these studies when they go out and publish it, and they said, but there's no scientific solid evidence here in the Tufts newsletter And people who are moderate drinkers of alcohol may have other benefits to their diets and their health habits. So they may exercise, they may be non-smokers, they may be doing mental exercises, they may be doing meditation. So they may just have other lifestyle changes that they make in addition to the fact that they are light alcohol drinkers. And so what the Tufts special report, right, special report, is basically saying is that there's no conclusive, solid evidence that you can take to the bank and say, boy, having moderate levels of alcohol really benefit my brain and my cardiovascular systems. So what it suggests you do here is limit your intake, which we know, and it's really, this is amazing. It's one small glass of something a day for women and up to 2 drinks for men. Don't start don't start drinking thinking this is going to help you. Avoid alcohol in special cases. Don't drink if you have liver disease or a family history of alcoholism. And of course, the obvious, don't drink while you're driving an automobile. So that's one part of it, and it's combined with the obvious effects of drinking in your brain. It's going to change your mood. It may alter your behavior and your ability to coordinate. So I summarize all that is it probably has a more negative impact on your memory than you would think it would have as a positive. And it may have and put you, maybe, at a higher risk of mild cognitive impairment, which then eventually might take you into Alzheimer's. So now let's go to the supplement, right? The supplement now wants to talk about how this stuff relates to your heart. So now we want to be strong in our thinking, right? We want to have mental faculties, and we also want to have good vascular health. Because what? Our brain is using about 20 to 30% of the oxygen that we take in. So cardiovascular health gets more attention than brain health, but yet more people, this was amazing to me, more people have strokes each year than have heart attacks. And yet most of our focus is on heart health. Let's focus more and more on brain health, which is why we've put together the Maximum Memory Mastery online course for people to start learning about the elements of their brain health and what I've been doing in the Live with Tony broadcast. If you just go back and look at some of them, I'm trying to do a better job of giving you subjects and titles and then a little bit of a sentence or so about what they're about. And the information that I want to put into those is all scientifically based and is all giving you some thoughts of what you can do to improve your brain health. But this is shocking to me. More people have strokes than heart attacks. 14% of people that are 71 and older, and half of the people over 85 have some form of dementia. Which explains why I have so many people in their 50s, even in their 40s, that come up and ask me, are there things that I can do to avoid the impact of having mild cognitive impairment that may lead to dementia, or the dementia that may lead to Alzheimer's? Are there things or exercises, and what can I do for my brain? And I get that. I've gotten thousands of people that have asked me that over the 20 plus years that I've done this work. And what this is going on to suggest is that 14% of, if you're over 71 years old, you're going to have some mild cognitive impairment. And if you're over 85, half of people over 85. But are there things, what we're learning, and this is what's so exciting, we're in the pioneering stage of brain research, with more and more research is being focused on it. We're in that pioneering stage. And so what are some of the things that we can do to help impact that? And so the connections they've made here from a study that was done and published in the Journal of Clinical Neuroscience. So you don't have to run out and buy these journals, but this is the Journal of Clinical Neuroscience. They found that vascular disease has an impact. You had high blood pressure, you have high LDL cholesterol, you have high triglycerides, and coronary artery disease. you have a risk factor of now mild cognitive impairment and dementia. So when you go for your annual physicals, especially if you're over 55, you want to look at obviously we're all looking at blood pressure today, but have you looked at your HDL, or your LDLs, LDL cholesterols, as a relationship to your vascular health that impacts your brain health? How about your triglyceride levels? And then how about your coronary arteries? Have you gone through nuclear stress testing or any of that sort? I mean, if you want to, now here's the big question. How long do you want to live? And do you want to live physically well as mentally fit? And if you want to do those two things, being physically well enough to be able to walk about and do what you physically want to do, and do you have mental capacities where you want to eliminate mild cognitive impairment or any of the elements of dementia and or Alzheimer's? The science is telling us today there are so many things that we can be doing that make a difference. And I've got some of that lined up from our foods to our exercising to our challenges, and this is what this whole series has been all about. And I've got more articles lined up in my backlog where I want to cover some of these things. But for tonight, I wanted to at least bring you back to the special report that came out of the Tufts newsletter and the special supplement, and how they're tying things together that talk about 94% of participants who developed dementia during the 6-year study had 2 or more of the vascular risk factors, versus 29% of the patients who had not transitioned by the end of the study. And I'm saying, boy, we want to be physically well as mentally fit. As I've seen surveys reported, people don't mind living to 100, which would be wonderful, but they never want to lose their mental fitness. So the good news is we're learning things today that can make a huge difference in minimizing our impacts to losing our memories or feeling like we're forgetting. And as I've said in other broadcasts, I want to get rid of the term senior moments. Stamp it out. It shouldn't exist. We need to learn what we can do and how we go about do it. And so we're back to, here are some things you can decide. Do I want to live to be a ripe old age with mental fitness and physical being? Well, then you got to make an investment in yourself, and make that investment as fast as and as soon as you can, whenever that is, and the benefits become yours as your return on that investment. Until tomorrow, tomorrow's Thursday, I'm back in the 3 o'clock time spot area. We shall see you then, and I'll pick up some of the latest reading. I've got a number of articles I can't wait to keep sharing with my Live with Tony audience. So any notes, you send them to adottino@aol.com. And until then, be safe, and we'll see you tomorrow.